There's a lot of hype around zirconia implants, but is it worth your time? Zirconia crowns we've used for many years successfully without a problem, and we've understood zirconia when it comes to crowns. Now, what about dental implants? Well, the only way to find out if something is viable for you to use in your practice is to go through the literature, and that's exactly what I did. So before we even look at zirconia implants, let's examine, do we really need an alternative to the commonly used implant, which is a titanium implant? Well, according to a lot of papers out there, maybe we should be looking at an alternative because, as we know, titanium implants aren't perfect. And one of the big issues we face with titanium implants, at least for a small percentage of them, is peri-implantitis, where you have the tissues around the implant getting inflamed, leading to bone loss over time, maybe eventually the loss of the implant as well. So titanium implants, we do see peri-implantitis, they're not immune to that. There are other problems with titanium implants. We have seen implant fracture, we've seen abutment screw loosenings, we've seen an issue where if a patient has a very thin biotype, then the titanium implant can even potentially show through, and if the patient has a high smile line, that's definitely going to be a problem. There's even some literature about corrosion of titanium implants. It seems to be a very, very small percentage, but over time it seems that maybe there is some level of corrosion happening, which again can lead to peri-implantitis or the loss of the implant itself. So now, with all that said, it seems like, yes, we should be looking at a better alternative. So when we talk about zirconia implants, what form of zirconia are we exactly talking about? We're not talking about the monoclinic form, we're not talking about the cubic form, which is prone to fracture. We are talking about the tetragonal form, which has additives, for example, yttria, which stabilizes that zirconia. And this is what is going to be used as a dental implant. Now, there are many properties of zirconia which we may want in an implant. One of them is low porosity, it's high density, it has good biocompatibility, and it seems to be relatively plaque resistant. And of course, it's aesthetic because it's white. Even if you have a thin biotype, you're not going to have this issue of the implant showing through the tissues. So a couple of things we like about it. So now it's time to put these materials to the test and see if it really makes a difference in outcomes for our patient. Let's go down to the most important criteria, which is long-term success rates. Now, your traditional osseointegrated titanium implants have a very nice success and survival rate. And reading from the literature, according to Boozer et al., the survival rate of your regular titanium implants is 98.8% and a success rate of 97%. How do zirconia implants compare to that? Well, at least from a systematic review and a meta-analysis, the survival rate is 91.5 to 98.3% and a success rate of 91.6%. So it seems to be a little bit lower compared to your traditional titanium implants. But maybe that can be attributed to the fact that the technology is newer, we're still learning about it, we're probably still making mistakes with it, and we're going to get better over time. The literature also reports there seems to be a less of an inflammatory reaction around zirconia implants with longer junctional epithelium and denser collagen fibers when compared to a titanium implant. So if you look at the literature, it seems like soft tissue-wise, the zirconia implants seem to be doing better than the titanium implants. But that's not the entire picture. There's more to look at. A paper from 2016, which was a systematic review about the survival of these zirconia implants, pegged the survival rate after 1 year at just 92%. Now, that's quite a lot. If you have 100 patients, 8 patients are going to have failure within a year. That's something to be cognizant of. This is technology which is rapidly changing. This is not something which you can immediately put into use in your private practice because we're still learning about it. Now, remember what your patient is coming to you for. Your patient is coming to you for a tooth, not an implant. So once you place this zirconia implant, do those implants have the same prosthetic options which you would get with a titanium implant? In most companies, zirconia implants occupy a very niche part of their catalog, and you may not be able to get all the fancy prosthetic options which you would typically get with a titanium implant. And this is something to keep in mind, because if you place the implant and you're limited with your options and you're going to be able to deliver a not so ideal result, your patient is not going to be so happy, even though they've got the fancy zirconia implant. And then let's talk about cost. Right now, zirconia implants in the market can be anywhere from 3 to 5 times more expensive than a traditional titanium implant. And the advantages of these implants are still not very clear, and there isn't enough evidence to support them long term. All of the papers out there for zirconia implants will tell you that there is insufficient long-term evidence because these papers, the years which they actually research is maybe 1 year, 2 years, maybe 5 years, but we don't have good long-term data of 10 years and 20 years to show that these implants are successful and more successful than titanium implants. And that's simply the reason why I do not implement these types of implants in my practice. My suggestion is zirconia implants at this time need to be considered more for an academic setting or a research setting rather than a private practice setting. I do know that some private practitioners are already placing zirconia implants, Personally, I wouldn't be taking this kind of risk for my patients. I would wait for the technology to mature, make sure that it's viable, and then start implementing this kind of technology. So to summarize what we said, zirconia implants are an up-and-coming alternative to titanium implants. They have certain advantages, especially the aesthetics, the biocompatibility, and it seems like the soft tissue reaction is better than titanium implants. But of course, they have disadvantages. It seems like the long-term success of these implants is not as good as titanium implants, and there's just not enough long-term data to also help us make a decision to use this for our patients. There is also issues with the limitations of the prosthetic options available for these implants, and of course there's the problem of cost, and it's 3 to 5 times more than your regular implant. With all that in mind, I hope you're able to make an informed decision on whether you would like to implement zirconia implants for the patient that comes asking for this, and make a sensible choice. I hope I've confused you enough. This is the Dental Review Guy signing off with a smile.